Hello everyone and welcome. Today we're diving into a rare and often overlooked condition affecting the urinary system, urethral lymphangioma. This video will explore what it is, what causes it, how it's diagnosed, and the available treatment options. So, let's embark on this journey of understanding together. The exact cause of urethral lymphangioma remains somewhat of a medical mystery. It's generally considered to be a benign, non-cancerous malformation of the lymphatic vessels within the urethra. Several theories exist. Some experts believe it might be congenital, meaning it's present at birth due to an abnormal development of the lymphatic system during fetal development. Others suggest it could be acquired, perhaps arising from trauma, infection, or even prior surgical procedures that disrupt the lymphatic drainage pathways in the pelvic region. However, these acquired cases are exceedingly rare, and the underlying trigger often remains unidentified. Now let's talk about the pathophysiology. Urethral lymphangioma involves the abnormal proliferation and dilation of lymphatic vessels in the urethral mucosa and submucosa. These dilated vessels form cysts, like spaces filled with lymph fluid. As these lymph-filled cysts enlarge, they can obstruct the urethral lumen, leading to various urinary symptoms. The extent of the obstruction and the size of the lymphangioma determine the severity of the symptoms experienced by the patient. Importantly, the condition is localized to the urethra and doesn't typically spread to other parts of the body. Unfortunately, precise epidemiological data on urethral lymphangioma is scarce due to its rarity and the possibility of underdiagnosis. It's considered an extremely uncommon condition. Because of the limited case reports and studies, it's difficult to determine its prevalence, incidence, or specific risk factors. Some case reports suggest that it may be more common in children, but it can also occur in adults. Furthermore, there doesn't appear to be a strong predilection for any particular race or geographic location. The signs and symptoms of urethral lymphangioma can vary depending on the size and location of the lesion. In some cases, small lymphangiomas may be asymptomatic, meaning they cause no noticeable problems. However, larger lesions can lead to a range of urinary symptoms. These may include difficulty urinating, a weak or interrupted urine stream, urinary frequency, urgency, dysuria, or pain during urination. In some instances, patients might experience hematuria or blood in the urine. In rare cases, a palpable mass may be felt in the perineal area. The symptoms can be quite variable and may mimic other urinary conditions, making diagnosis challenging. Diagnosis of urethral lymphangioma typically involves a combination of clinical evaluation, imaging studies, and endoscopic examination. The doctor will start by taking a thorough medical history and performing a physical exam. Urinalysis may be done to check for blood or infection. Imaging studies, such as ultrasound, MRI, or CT scans, can help visualize the lesion and assess its size and location. However, the gold standard for diagnosis is usually cystothroscopy, a procedure where a thin, flexible tube with a camera is inserted into the urethra to directly visualize the lesion. Biopsy of the lesion can then be performed to confirm the diagnosis histologically, ruling out other conditions like urethral tumors or cysts. Urethral lymphangiomas are generally not classified into specific types or stages like malignant tumors. Because it is a benign lesion with minimal variation in appearance, a formal classification is not required. It's primarily described by its location, G, anterior or posterior urethra, size e.g. small, large, and whether it's symptomatic or asymptomatic. Treatment for urethral lymphangioma depends on the size of the lesion and the severity of the symptoms. Asymptomatic small lesions may not require any treatment at all, just observation. However, for symptomatic lesions, various treatment options are available. These may include endoscopic resection, where the lesion is surgically removed through a cystoscope. Laser ablation, which uses laser energy to destroy the abnormal lymphatic tissue, is another option. In rare cases of large or complex lymphangiomas, open surgical excision may be necessary. The specific treatment approach will be tailored to the individual patient's needs. Recurrence is possible after treatment, so follow-up monitoring is essential. Unfortunately, there are no known preventative measures for urethral lymphangioma, particularly those that are congenital. Since the exact cause is often unknown, specific prevention strategies are difficult to develop. Minimizing urethral trauma and promptly treating urinary infections might theoretically reduce the risk of acquired lymphangiomas, but this remains unproven. Early detection and prompt treatment of any urinary symptoms are essential for preventing complications. The prognosis for urethral lymphangioma is generally excellent, as it is a benign condition. Complete surgical removal often leads to a cure. However, recurrence is possible, so regular follow-up appointments with a urologist are crucial. Recent research has focused on refining endoscopic techniques and exploring novel therapies like sclerotherapy, where a sclerosing agent is injected into the lesion to collapse the lymphatic vessels. While urethral lymphangioma is rare, continued research and awareness will help improve its diagnosis and management, ensuring optimal outcomes for patients.